One of the most frustrating things for me as a physician is when people or my patients aren't feeling right and they tell me, I just had some labs done by my prior doctor and they said everything looks normal, but I feel terrible. I'm tired in the afternoon. I have sugar cravings. I'm not sleeping right. I have brain fog. I don't know what's wrong because my doctor said my labs are normal, but I don't feel right. In that situation, your body is telling you something that the labs are not showing. And in this video, I'm going to talk about insulin resistance and how it is a hidden disease that is very hard to pick up on labs, but has a tremendous amount of symptoms. And I'm going to share what those symptoms are. I'm Dr. Stephen Gabriel. I'm a board certified physician and a metabolic expert. And in this video, I'm going to share and talk about insulin resistance, what it really is, what the symptoms are, or what you may be feeling if you have insulin resistance. And I'm going to put a caveat out there that the data shows that about 88% of us have insulin resistance in some form. So this video is probably going to be relevant to you. The third thing that I'm going to talk about is what is the blood tests that are commonly done to look for this, but don't show it, and what the blood test is that you should be asking for if you want to see if you truly have insulin resistance. And the next thing, which I think is the most important, is what are the things you can do to fix it or to improve it on your own at home and get started today. So the first topic is, what is it? This gets thrown around a lot. We're all kind of assuming we don't have it, but the reality is the majority of us do. And here's what goes on. So in our bloodstream, the river of life, our body tries to keep the bloodstream heavily regulated, whether that's with pH, sugar, red blood cells, all of these things are regulated. One of the main things that our body is regulating is how much glucose is in our bloodstream. And for anyone that's had lab tests, you know that a common lab test is glucose. And that is looking at, is your body keeping that regulated? And let me explain how your body does that. It does it with the pancreas, which produces insulin. And insulin is a hormone. And what that hormone does is it gets released after we eat, and it is to drive the sugar level down in our bloodstream and move that sugar from the bloodstream into our cells, into the trillions of cells of our body, and keeping it at a normal level. So we eat, the sugar level goes up, the pancreas, the organ, senses that elevated sugar. After we ate, it releases insulin with a pump, and then that insulin attaches to receptors on cells, allowing the sugar to go in. If we keep eating, or the insulin that it released isn't working, meaning it's not attaching to the receptors properly, it will continue to sense a high sugar level and keep producing more insulin. And this is what insulin resistance is, this drive to produce more and more insulin, even when insulin's being produced and the sugar doesn't go down. And so here's what causes this, is that really high carbohydrate foods or eating ultra processed foods, eventually these receptors don't respond to the insulin anymore. The sugar doesn't go down, and the pancreas keeps pumping out insulin, and eventually it gets tired. And we are resistant to insulin at this point. And our blood sugar is staying normal because we're producing so much more insulin, but the pump, the pancreas, is getting tired. So now let me share what are the symptoms of when that's happening. This is when the blood sugar is still normal on blood tests, but your pancreas is producing a lot of insulin, so our insulin levels are high. And here's how it usually feels, or how I know when patients describe it to me. It's, hey, doc, I'm trying to lose weight. I've been exercising, but it's just not coming off, particularly around my midsection. Hey, doc, I'm eating in the afternoon and I am dead tired. I feel like I need to go take a nap. Hey, doc, I am eating in the afternoon and I go back to work and I have brain fog. I can't think. My memory isn't right. There's another thing. Sometimes patients show me, why am I getting these little tags of skin on my neck? That's almost always insulin resistance. I have some dark spots in the creases on my leg. What is that? That's almost always insulin resistance. The other one is, I'm I know you're telling me not to eat junk food, but I am just craving sugar. These are all signs and symptoms of insulin resistance. You're producing a lot of insulin, more than you need to try to get the sugar out of your bloodstream. And your body's doing a good job at this point. It's doing its best. The pump is working overtime to try to solve the problem, but you are feeling it in other ways. Something is wrong. And what that something wrong is that your insulin level is too high, even though your sugar is normal. And the test that just about all physicians use is called the fasting glucose. And the fasting glucose senses the level of sugar in the bloodstream. And that can be totally normal, even though the pump is failing and it's producing so much insulin. The reason why I say the pump is failing is because it's getting tired. Even though it's working really hard, it's getting tired. And a matter of fact, the pump can work overtime, producing too much insulin for 10 years before it fails. Insulin doesn't come out and you're a diabetic. And that's when the fasting glucose picks up the abnormality on the test. And that's why, if you have these symptoms and you want it tested, you should tell your doctor, I would like a fasting insulin test to find out if you are insulin resistant. Now, the next topic is, what can you do about it? And there's really four main things you can do about it. And I'll condense them into three because two of them are connected. The first one is resistance training, and this is weight training. This is some push-ups. This is the walk after eating. This is going to the gym. This causes your muscles to get stronger, as we all know. But when the muscles get stronger, they put some extra receptors on them because as they're getting stronger, they need more energy in the form of glucose. So the muscles become a glucose sink. They help lower your glucose level and therefore take some of the pressure off of the pump that is the pancreas. And therefore, working out and doing resistance training really helps insulin resistance. The second thing is what you can do with eating. And here's what you can do with eating. You can eat protein and fiber first on your plate. So when I get a plate, I've really put this into practice. Usually you have on there maybe, a piece of fish, some lettuce, some vegetable, some rice, let's say. And in this case, what you should do is go and eat the lettuce, go and eat the vegetable, the protein before you touch the rice. You want to eat fiber and protein before carbohydrate. And carbohydrate is another word for sugar. The other thing you want to do is you want to stay away from refined sugars, ultra processed sugars. This is stuff in a bag, in a box, candy. This kind of stuff really overtaxes your pancreas and really causes insulin resistance and all these symptoms that we're talking about. The third thing is sleep quality. And the reason why I bring this up is because multiple studies now have shown that you become insulin resistant with just one night of poor sleep. And everyone knows what it feels like with a night of poor sleep. I'm going to do a talk on sleep in the future. But in general, in our adult life, we know what a good night of sleep feels like. I would encourage you to go for that because just one night of bad sleep increases insulin resistance by 25%. Huge, huge effect with sleep. So here's my takeaway here is that insulin resistance is a hidden disease. It doesn't get picked up on lab tests. The disease starts about 10 years before the lab tests pick it up. What the lab test is, and that is a fasting insulin level to ask your doctor for if you have these symptoms. You can diagnose yourself essentially just by having these symptoms. But if you're not sure, go ask for the insulin resistance test. The other thing you can do is this is the reason why I created the Beyond Metabolic Assessment. It looks at 6 different personal areas surrounding metabolism, and one of them is all around insulin resistance. So you can get a personalized score, see the things that you can do right now, how severe or not severe it may be. It only takes 10 minutes, super easy, and it's free. If you like this content, I'm doing 2 of these videos a week. I love doing them. I love talking about things we can do, simple things we can do for metabolism. Next week, I'm going to be talking about ultra processed foods and how they rewire our brain. They're absolutely terrible. I'm excited to explain what they do so that you start looking at them like drugs the way that I do. The link for the assessment is down below, and subscribe below if you like this kind of content, and I'll see you in the next video.